have here a physiotherapist from Nuffield Clinic. Want to look at juvenile arthritis. Want to find out what this big word actually means, what causes this, how parents can identify symptoms, and the role the physiotherapist plays in managing this condition in children and everything that comes with it. Actually, have two guests. The first one is Mr. Samuel Eyim Abua. He's a principal physiotherapist with Nuffield Clinic. Mr. Samuel, good morning. It's good to have you here. Yes, and my lady here is Priscilla Aiken. She's in charge of market and also administration. Good morning, Priscilla.
Good morning.
Great. So, I want to find out juvenile arthritis. For me, I mean, when I got the information, it was the first time of hearing such a thing. I thought when it comes to arthritis, it has to do with the older folks.
Yeah.
Break it down for us. What does it mean?
Okay, thank you very much, madam. When we talk about juvenile idiopathic arthritis, we are talking about group of conditions or rheumatoid conditions that really affects children from age 6 months up to 16 years. And that's what we talk about juvenile idiopathic arthritis is.
6 months, that's quite early.
Yes, please.
So 16 years.
Yes.
Wow. So what causes this?
Actually, it is an autoimmune disease. When we say something is autoimmune, our body has the autoimmune system that really is a kind of soldiers in the body that really, when you are sick, it helps to fight against any foreign body in the body. Okay, so but it comes away that this autoimmune system, they try to destroy or fight against the body itself and try to destroy the tissues and other cartilages in the body. So that is what this condition comes about. It's really, there's no specific cause of it.
Okay.
But what studies have made us know is that the body fights its own self. And that's why we say it is an autoimmune condition. Yes, please.
Okay. Are there things that put some children at a risk of getting than the others?
Yes, please. Study has made us know that actually there are certain environmental factors you can talk about. Something like some viral infection conditions can lead us to having this kind of has a risk factor. And then also like if you're a mother and you are pregnant and you smoke too, it can really have some effect of getting this kind of condition. When you talk the risk factor is something like infection. Yes, because there are certain infections that also something like Shigella species, antibodies, and they go or Salmonella species. That's also if you are sick of this, you are prone to getting this condition.
Yes. I actually understand there are types, that there's actually a bigger word that
that's what I say. It's a group of autoimmune conditions. Okay, so there are some common group subtypes that we can mention of oligoarticular. Okay, and you have
medical terms.
yes, when you have that really, when you say that the oligoarticular, it really affects about from 4 or lesser joints. Yes, and then and usually it affects the wrist, the fingers, and sometimes the ankle. But then you have the polyarticular type, which also that affects more joints or more than 5 and joints of the body. And then we have systemic type of and then we have enthesitis related. When you say enthesitis related, that means that the enthesitis is where the ligaments and the muscle tendons really attach to the bone. So that spot is also the disease can affect. Yes. So these are some of the commonest form of juvenile idiopathic arthritis subtypes. Yes.
My concern anytime we sit here, we are discussing some diseases. The concern always is how early Can we pick it up so parents can
Yes.
come in? Are there some signs that will show for them to identify and know that there's actually something going on with their child? Yeah.
Yes, please. There are some signs. Okay, yes. This condition, as you said, is chronic type. Okay, yes. When it starts, it's a typical sign that the joint you can see the joint a pain. Okay, there's inflammation going on, so definitely the joint feel pain. The child will.
Is it all over?
Yes. Okay.
Pain?
No, just pain in some of the joints.
Some
The,
of the
the joint
joints.
that affected. Yes, the child will be complaining of chronic pain. The pain doesn't stop maybe a day or two. It's continuous kind of pain for 6 weeks or more. Can even be a year. Okay, yes, and you'll be complaining of this pain. There's swelling. Okay, what's called sometimes because of we have caused synovitis, because the joints have some fluid called the synovial fluid, and this fluid sometimes gets inflamed. Okay, so sometimes you can see that the joint is stiff.
Stiff joints.
Yes. Okay.
So it means they're not able to move
yes,
well
to move
walk.
well, exactly.
Okay.
Yes, when this happens. So these are some signs that the child you can see from the child, and then you have to really follow it up to the hospital for us to actually go through some investigations to actually say that this is what is happening. So we need to be managed. Okay. Yeah.
Okay. You had mentioned as early as 6 months. At age 6 months, I mean, most children, they are babies.
Yes,
They're not
exactly.
able to talk. How are they able to experience and say, I have a pain here?
Yes, you
This is what I'm
know,
experiencing,
usually,
and then to
yes.
communicate.
You see, the body, the defense mechanism for the boy, especially babies, are really crying when something is not going well with them. Okay, yes, they will cry. So suppose you're a mother, you're bapping your child, and maybe you hold a hand and try to bap for the leg, and the child really resists or try to cry excessively. Okay, yes, you put her or him on bed to sleep, and you feel that the child is really moving here and there, and then you can see that something is wrong with the child, so we need to take the child to the hospital.
Okay.
Okay, yeah.
Okay. When they finally come in, are these symptoms enough, or you further go on to do some checks? There are some labs,
Yes, that's
scans,
yes,
and all
you
that you do.
yes, please. Usually when it comes, you take a history, okay,
History.
medical history
Okay,
for
okay.
years, and then also before then you do some lab investigations, okay, sometimes to check the inflammatory markers, okay, and then actually there is no specific laboratory test that can tell you that, oh, because this is positive, so the child has this condition. But the lab test we do try to rule out certain conditions. Sometimes you can also go into imaging to do X-ray and to do MRI just to rule out certain condition that might think that this is the case of it. So yes, you don't usually just look at the sign and conclude that this is, you go further to investigate. Okay, yes.
It's just 15 minutes at top of that. I have here Mr. Samuel Himabwa, Principal Physiotherapist with Nuffield Clinic, and also have Priscilla here in charge of administration. We're discussing juvenile arthritis. Priscilla, I want to find out. So, in fact, you're the only clinic I know who's doing this campaign for the entire month. The whole month of July, you've been on and on, your webinars, your talks, your posts, and all that. What about this? What exactly? Why this?
All right, thank you. So the month of July is actually Juvenile Arthritis Awareness Month. And at Nuffield Clinic, we deal in joints, bones, and muscles. So
That's
we
what you
have,
generally do.
yes,
Okay.
orthopedic, rheumatology, and physiotherapy.
Okay.
Yes, and we have seen a lot of joint-related issues where people even understands it to be an adult disease. Meanwhile, no. Children get arthritis too. So as the month is dedicated for juvenile arthritis, we thought of educating the public about juvenile arthritis. So we've been to schools, we've been to churches, we've been having a media tour talking about juvenile arthritis through the webinars and other educational platforms. We are talking about juvenile arthritis. And our theme is listen to the pain they cannot explain. Listen to the pain they cannot explain because, children, even as old as 5 years, may be going through pain, and they will still be playing. You may not even, whenever they explain to you, how will you even understand in the first place? One of our doctors once mentioned that children delay before they actually make complaints. So once the complaint is made, we should take it serious. They really mean it. But sometimes
sometimes they will come, oh, my head is aching. We'll say sorry. Sometimes you pray, okay, you are fine. Then it goes away.
it goes away.
There's attention they need. They need that. You just say something, okay, then they never come and complain again. You give them what they want, and then there's no complaint of any pain.
This is where listening to the pain is more important, because if he comes and says my knee aches, okay, fine, the next day, probably not the next day or the next 2 days, I mean, the complaints will keep coming. If not right after that time, the complaints will keep coming, and we should listen to it. We should pay attention to it, and we should seek help at that moment, because doctor mentioned that you don't know where it will extend to. And this is not a disease which can be cured, but rather it can be managed. So if you do not seek help any moment from the time you've been informed, and the child grows with it, we don't know. We don't know what the damages it can cause. Yes, and Nuffield Clinic is available for assessments. We are currently having assessments for children. If you think your child has joint pain, joint problem, kindly bring your child. Let's have an assessment for the child.
Okay. You said, Mr. Samuel, I was going to ask about treatment and management. What is the goal here? Is it for you to, when you are managing something, you are treating it, so maybe after a couple of weeks you are fine, medication, physiotherapy, you are back to good how you were. What's the goal here? Is it, I mean, from what she said, it's for life, it's chronic. The goal is not to ease, the goal here then is to ease the pain, make sure the stiffness is down, but then you manage it till they are into adulthood. It's going to stay with them. It's there. It won't go.
Yes. Human beings were, God created us to function, right? No matter the condition you are in, you have to function. The body has to function. Yes. But this is a condition that can cripple you, and that's we don't want that to happen to any child. Okay, yes. So if it is well managed, the child can really go about doing his or her daily activities. Yes. So in that way, because sometimes if you are in severe pain, you are bound off to just be in bed or to sit down without doing anything. Okay, but that is not so. If a child or the parent are well educated, or we give them information or education that, if your child is complaining of this, or your child has this condition, please bring them to Nuffield Clinic or any facility that can manage your child well, so that your child can go back to school, to play, to function as a normal human being. Okay, yes, that deformity, the pain will not reach a point that it will deform the child not to function as a normal human being. And that's very important. Where we're going. So functionality is very, very important to us.
So when it comes to treatment, is it a general treatment for every child, or is based on maybe the child's age, the symptoms that they are showing, or?
Yeah, sometimes some of the, especially in the physical therapy, some exercises, some are tailored exercises that a child with specific problem, we have to let him or her go through it. Okay, and some can be general, common exercises. So we will mention some that parents can really help their children.
So this is what your role is in managing. That's
yes, exactly. Yes, please. Does. Yes. Okay, we try to help to manage the pain. Okay, good. Trying to also strengthen the muscles, the joint, flexibility of the joint, also very, very important, so that it can reduce stiffness. Okay, yes. So this is where the physical therapist play a major role, so that the child can really function so well. Yes.
When it comes to exercises,
and this will also this is also help to actually reduce the complication aspect of maybe neglecting. If the child doesn't do anything, then sitting down because of pain, because then the joint becomes stiff and you cannot move it anymore. You can't walk better, and other things. Then we don't want that to happen. Okay, yes.
Okay.
So
Okay. I was going to ask about exercises. So when it happens, do you need to get the school involved? Maybe the child would want to be involved in sports in school. Do
yeah,
you
so that
encourage
we
them to
need
be
to
involved in all that?
well, we need to actually assess the child and know how what he or she can do. Okay, if he needs some kind of strengthening exercises, you know how to. You don't sometimes have to put strenuous things on the child. Okay, yeah, then the joint. If you are exercising the muscles, okay, and they is already in severe pain,
Yeah.
so we need to have a qualified person who knows that this is how you should, the kind of weight you have to use to exercise this muscle, what kind of exercises you need to do. Okay, so you will give them advice. Okay, maybe the child who having or go to school, he has no knowledge of what he's supposed to do or not, what he's supposed not to do, and you go and do such things to complicate things. That's why it's good to see a physical therapist or rheumatologist or orthopedic specialist to actually advise you on all this form of management that the child needs.
Okay.
Yeah.
Okay. Does this continue? Do you encourage the parents also continue this at home when it comes to
Yes,
management
yes,
they come
please.
into the clinic
Yes,
to do
yes, yes,
at home?
please. Yes, please. Actually, you see, this kind of management is not only bringing the child to the clinic or the hospital and then you wait till your next visit. No, you need to, whatever you go to the clinic, if the therapists have seen you and taking you through some exercises, when the child goes home, the parents should help to take the child through these daily activities or the exercises that he's been taught to do.
Okay.
Yeah.
Okay.
Yeah.
The is it just you? So or there's a group of therapists who come in apart from the physio? Is there any other like medication?
Oh,
Other specialists who come
some,
in?
yes, actually, yes. That's a, it involves, yeah, like rheumatologists, it involves to medication, some medication,
Medication.
yes, to really reduce the inflammatory processes that the body is going through, okay, in the joint. Okay, yes. So it's not only through exercises, but other forms of specialities also play their part to manage this condition. So it is a teamwork.
A teamwork.
Yes, it's a teamwork, not just one speciality that deals with them. No.
Okay.
Yeah.
Okay. Okay. We have this question as saying, "Good morning to you. What do you think is the most challenging aspect of living with juvenile arthritis?" That's the first part. And how can families and healthcare providers work together to address these challenges? That's Aaron in Accra. Good
Yep.
morning to you, Aaron.
Yeah.
Yes.
Thank you, Aaron, for your question.
The challenging aspect of living
Yeah.
with juvenile arthritis.
Yeah, the challenging aspect is
So that's
one.
more like the complications.
Exactly.
Okay.
Sometimes, well, if it's not managed early, okay, or if not detected early and managed, then the complication sets in. But there are some subtype that I mentioned that sometimes it can even involve the eyes.
The eyes.
Yes.
From
Okay.
joint to stiffness to the
Yes,
eyes.
yes. It can involve the
Okay.
eyes. So sometimes you can see that your child eyes have become reddish.
Okay.
Yeah. So it's always also good that we take our children to the ophthalmologist to do eye screenings. Okay. Yes, because sometimes you can see your child suddenly eyes become reddish. You don't know what actually is wrong with that. Okay. You might think that maybe something has hit the eyes with something, but no, could be this form of condition. Okay, yes, because it really can, the immune system can fight certain organs in the body. Yes, can travel to this. Sometimes with other complications that it can arise is the growth of the child is also disturbed. Okay, yes, even sometimes it can be as a result of some medications that the
Okay,
child is
okay.
using to.
Okay.
Okay, yeah, so
Okay.
it's really very important that you usually have to seek healthcare to get good advice. Okay, how to manage this, your child can live better life. So it's very, very important, please. Yeah.
Okay.
And then also, yeah, the
second
challenges,
part.
yeah, the second part, that's difficult in our part of the world or our country, Ghana, where there's shortage of specialists who can deal with these conditions.
They're
Okay,
not
in yes,
physiotherapists.
in rheumatologists especially.
Rheumatologists.
Yes, you see,
What does rheumatology do?
they are
Rheumatologists,
specialized
what
with
do they do?
also joint
You
conditions,
also
but
with
you
the
have the
joints.
you have other form of arthritis called rheumatoid arthritis. Okay,
Okay, okay.
so you
Rheumatoid
see,
arthritis,
yes,
okay.
it's a medical officer specialized in this form of conditions
Okay.
to take care of that. Yes, so they play a major role in this condition too. Okay, yes. So we go to even in the whole country. I think we have not even up to 10 rheumatologists. Yeah, so you can imagine in the district areas
Levels.
and yeah, the villages. So it's really difficult sometimes. And this condition really is not something that the child complains of it and then you say, oh, it is this. Even sometimes you might go to a health facility that they might not detect it well.
They might
Okay,
misdiagnose
yes,
it.
misdiagnosis.
Okay.
Okay, so it's very, very, we need to create the awareness so that they can go to the correct facilities and then they can get better help. Okay.
And that is why our awareness creation is not ending in July. Indeed, we are taking this throughout the year for all parents to be aware of it, that children get arthritis too, and we should listen to their pain. Yeah.
You see, my concern here is with the 6 month babies. Yeah, the physio and all that. They go through all that.
Mm.
Wow. Wow.
You see, the home exercise, that is the best one of the home exercises. So that the children, you can take them through is swimming. Where the swimming is
That's a form of management treatment.
swimming is very good at, you see, the body, it really exert less stress to the body.
Okay.
Yes, and that is a good way to, if you are someone with such condition, I will recommend that you learn how to swim also. Okay, it will help. Okay,
Since
yes.
you had mentioned you can't really pinpoint on the cause, is it something that can be prevented?
Uh, the
The
condition,
condition.
well, prevention, because we no, actually, we don't know how the body is. This what I said, that the actual cause is
You can't really
unknown.
pinpoint it,
Yes,
yeah.
yes, actual cause is unknown. Yes, there are some risk factors, but even it's not like 100% that, oh, if we're doing this kind. So we just giving education so that we just know that this is autoimmune, something it is within the body that
Okay.
actually fighting against itself.
Okay.
So it's hard to say that. Okay,
Okay.
yeah, it's just
That's
that
what you can do to prevent it.
yes, if you have it, we can manage you to live to your fullest. Okay, without complications setting in as a result. That's why we are here.
Okay.
Yeah, to create awareness. Yeah.
Okay. Priscilla,
Hi.
your final words. Our time is almost up for parents who
Yeah.
have experiences. Yeah, children have said there's this pain here, there's this pain there. What would you tell them?
Okay. I would tell every parent who has actually noticed a child with joint pain to bring the child to Nuffield Clinic for an assessment, because you won't know what exactly is wrong with the child. Also, because we are extending this awareness campaign to the end of the year, we are also asking, or we are telling the public that if you are a school, you are a church, you are a women's leader, you are Sunday school teacher, and you want to organize parents and you want us to have the educational conversation with parents, we are readily available. So you can reach out to us on all our social pages, nufieldclinic.com, on our
Nuffield is
website,
spelled Nuffield.
yes, on our website, on our pages it is Nuffield Clinic GH, and you can reach out to us on our WhatsApp number 050 377 1983, 050 377 1983, and we will help you and your child.
Okay. Okay. Is there some of your closing comments?
Yes, thank you. Well, my closing comments, I will say to every parent that there is still hope as far as this condition is concerned. Yes, it can be managed. it's not a death sentence. So if your child you complains of joint pains, please don't delay and bring him or her to Nuffield Clinic. We are there to support you and take good care of your child. Thank you very much.
Okay, thank you so much. Thank you so much for coming. So you say juvenile arthritis can be managed, it's not a death sentence.
Yeah.
We say thank you so much.